Welcome to Positive Recovery MD. If you're listening, chances are you want to create happiness around you and thrive in your life. We're glad you're here and you've come to the right place. This podcast will inspire and motivate you to not merely survive your recovery journey, we'll give you the tools to build or strengthen your foundation to thrive and flourish in your life. Each week, we'll come together as a community to have authentic conversations around addiction, recovery, and what matters. Growth and progress, not perfection. All while developing positive habits for you to utilize in your life. To learn more, please visit positiverecoverymd.com to sign up to receive the daily positive interventions that we'll review, as well as gain access to exclusive Positive Recovery content available only to Positive Recovery MD listeners. All right, let's get started.
Welcome, ladies and gentlemen, boys and girls, to yet another installment of Positive Recovery MD Podcast. I'm your host, Dr. Jason Powers. Today, Julie DeNova is getting a break. Her son is a drift racer professional, and he's in a race in Florida, so we wish you good luck. Our guest today is somebody that I'm really excited about, A, because not only was he the best man at my wedding, but B, I get a guest that I can make fun of the whole time, which will be a lot of fun for everybody, including me. He's a physician. He's written a couple books. He's a TV star. He's really a rock star surgeon. He graduated top of his class or close to it anyway at Baylor, went to one of the top residencies in surgery and general surgery in the country, University of Michigan, where he was chief resident, comes back, is one of the first to work on robotics, is a whiz with laparoscopic surgery. I've actually watched him. I got the pleasure of scrubbing in a couple times. And this guy may not have had the best hand-eye coordination in high school, but let me tell you, a better surgeon technically you probably won't find. Secondary to how big his heart is. Whenever I'm sick, I think, call Garth. You don't know that, Garth, but like if I'm like, I need to go to the hospital, your name just pops in my head. He's one of the best, I guess, compliments I can give anybody. It's like, we walk around, we don't kill each other. We're not running up to and punching each other. So to say that somebody's ethical or honest, you're kind of like, well, okay, you take it for granted, but let's just say that's the baseline. He's got a great ethical thread through him. He's a good go-to guy. He is the guy who, when we had sleepovers at my house, and by the way, that always seemed to be at my house because my parents really didn't care to give us a curfew. So we would
That's right.
And we're talking like 7th, 8th grade. We would go to like a 24-hour Denny's or diner, and the guy would eat chili and eggs. And really, it's nothing more than, hopefully it's chicken eggs, but like a can of Alpo basically is just poured on it. The guy loved it. He loves steak. And now he's one of the biggest advocates of not eating meat. I've seen him on some HBO shows. He's an exemplar in the field. He's an expert. I want you to welcome Garth Davis. So thank you for joining us, Garth.
Wow, Jace, what an intro.
Just to remind you guys, the podcast has two missions. One is to provide hope to people. And so our guests don't necessarily have to have had addiction or gone through it, but people like I described, like Garth, who has found a passion, found a calling, and has a lot of great information to give and can help your health. They can deliver hope. And the second mission of the podcast is to provide a tool to increase well-being. And that's what the positive intervention is all about. So without further ado, Garth Davis, welcome to the podcast, buddy.
Thanks, man. It's totally surreal to be here with you staring at me. It's great, man.
I know it's been a long time. So why don't you tell folks about your journey, specifically not about you eating like dog food, but you did bariatric surgery, right? So you did help people who've got either a genetic predisposition or, quite frankly, overeating. You know, there's just a lot of overlap between alcoholic brain and the brain of somebody who's morbidly obese when exposed to sugar. I know that was my first drug of choice. I don't really think I have a drug of choice. My drug of choice is more. I'm sure my leptin is screwed up, but like I just don't feel satiety. So if not for like this workout gym and the heavy bag behind me, like I'm pretty sure I'd be a little bit bigger than I am. But kind of explain how you went from, you know, being a really good, but a technician or sort of a carpenter working on the human body in obesity surgery to being an advocate for this holistic approach to wellness.
Right. Yeah. No, it was kind of an interesting journey because, you get out of residency and I found like my calling or what I was good at. Cause it wasn't football or any of those things in high school, but what I was good at was laparoscopic surgery. Around the time I got out, there was this big kind of craze over doing weight loss surgery laparoscopically. And to be completely honest, what drew me towards the field wasn't the patient's dilemma, obesity is a disease, but rather this is what I'm good at, and I could put these skills to this surgery. And so for many years, I was interested in the surgery itself, what I'm doing as a surgery. But the interesting thing about the surgery is you follow up the patient quite a bit. And the more I got to know my patients and the more I saw what they were going through, I learned a lot about addiction, about this problem that a lot of people have. I think that when I first got into the field, and I think most of America looks at obesity as some kind of willpower issue, like, just eat less and exercise and it's not an issue. But the more I started doing research into it and really learning from my patients, I found that this was something completely different. And I didn't get it from my colleagues either. I would we have these big obesity conferences, and I'd go to these obesity conferences and I'd be there for a week. We didn't discuss food during that time. We barely discussed any kind of behavioral thought. We just talked about, how to cut someone. And if the surgery wasn't working, how to cut them differently. But we didn't get into this kind of what I think is now fascinating is what is causing obesity? Why is most of the country overweight now? Why do we have this increasing obesity? And when you look at the patients, it's interesting. I don't know if you know this, but they looked at some people that had gastric bypass surgery. And they asked them, if I put you have a choice. I could put all your weight back on, but you would be blind or you would be deaf. What would you choose? They were like, oh no, I'd rather be blind than be morbidly obese.
But not dead.
Okay. But blind.
Okay.
So it's interesting because if you ask a blind person, hey, we could make you see again, but you'll be deaf. They'll be no, I'm fine. I'm blind. They've done all these studies on that. Obesity is like the one kind of area where people hate it so much that once they're not obese, they'll do anything to not go back to where they were obese again, because they really hate it. So this isn't like they choose to be obese. It's not like a willpower issue. There's actually some physiologic things, and you kind of hit on it a bit. If you do functional MRI imaging of obese people and you compare it to someone with a normal weight, there's a lot of differences in the arcuate nucleus of the brain, the part of the brain that is the satiety that you talk about. And a lot of it has to do with dopamine receptors, which I'm sure you've talked about before. I think I saw you had a section of that in your book, didn't you?
Yes.
But anyway, so it's that same kind of pathway. And if you look at an obese patient's brain, as far as dopamine receptors, it looks like a
alcoholic.
Or alcoholic. Right. So there's something else going on. And this really is a physiologic problem. When you look at people, ancient man, we were formed thousands of years ago. And natural selection back then, natural selection doesn't give a damn about you growing old and seeing your kids go to, get married. Natural selection cared about getting you just to the area of the age of procreation. And so it basically doesn't care that you're fat. Like you talked about leptin. It doesn't care if you have excess leptin on your body. Now, you could have a whole bunch of leptin. You could be 500 pounds. You go on a diet and you lose a little bit of leptin, and your body's like, oh my God, we're going through a fast, and I need to get this person food and fast. So
hey, really quick, explain leptin.
Yeah, so leptin is interesting. So leptin is a hormone that the fat actually secretes itself. And that hormone feeds back to the most primitive parts of the brain, like the parts of the brain that control breathing, that control heart rate. And if leptin level is dropping, so you're losing fat, right? You go on a diet, you're losing fat. As you lose that fat, your leptin level decreases. And your brain, that's a signal to the brain that says, oh my God, we're starving and we need to eat right now. And it drives you to eat. And so it's an interesting feedback mechanism. And it's not the only one. We also have a hormone called ghrelin that makes us hungry. And PPY, and there's all these different hormones. So it's not, you just can't tell someone someone who says you need to just eat less and exercise more, they haven't lived, or what you say, walk a mile in shoes of who's morbidly obese. They just don't understand the factors that go into play in someone battling their weight.
Is it true that the more times you diet and lose weight, the harder it is each successive attempt, because you have the physiologic mechanism working against you, because your body thinks it's, go ahead. Explain that. Yeah,
it's interesting. They did a great study on this with The Biggest Loser. So remember that TV show, The Biggest Loser?
Yeah.
That's
not the greatest name. I didn't like it.
It's a terrible name, right?
Yeah.
It's like The Biggest Loser, but
shameful, right?
It's a play on words, and they would make them get up there without their shirt on. It was a horrible show. Horrible. I hated that show. But they studied these people long term, and what they found was they had a pretty high resting metabolic rate as an obese person. Most people do, because actually you have to expend quite a bit of energy
to maintain all that.
To maintain that, yeah. When they went through this massive drop in weight, they dropped their basal metabolism tremendously. Now, you would think that when they started regaining weight, because they all regained weight, that the metabolism would go back up again, but it didn't. There was like a permanent damage to their metabolism.
Even as they put on more muscle, which burns calories at rest?
Yes. Yeah. Putting on muscle does help, but not nearly the amount that people think that it does.
It didn't override. Wow.
Yeah, it didn't. And it definitely doesn't override the eating. So, you might have a basal metabolic rate of 1,200 and you work out, 500. So you've spent 1,700, but you could eat 2,000 calories, in a minute. And
so was it because it was a rapid weight loss? Like, in other words, if somebody's obese, did they say, well, why bother losing weight? Because if this is permanent, if my metabolism is going to go down, why bother?
Right, exactly. And so many of my patients have that exact attitude. They're like, hey, I've tried 1 million times to lose weight, been to fat camps, I've done this. Why bother anymore? That's a lot of people.
What do you say?
Well, you bother for several reasons. I mean, life is a challenge. We all have our challenges, and part of overcoming these challenges is kind of the beauty and the joy of life is facing these challenges. Number two, you can be successful. You got to do it correctly, and we could get into that. You basically got to get this idea that anything that you hear in America about how to do it is basically wrong. It's got to be, right? We're the most overweight, sickest country in the world. But I do, with my patients, I first got to let them understand that this is a disease. Like, a lot of them feel so guilty. Their family makes them feel guilty. Society makes them feel guilty. And I got to let them understand this isn't your fault. It's like you wouldn't blame someone for getting cancer. You wouldn't blame someone for having asthma. And it's the same kind of area where you got to come up with solutions. And those solutions may be dietary and behavioral health and exercise. They may need a tool such as a medicine or a surgery to help them be successful. But we can be successful. There is hope.
So what are some of the things that we hear in America that are just dead wrong in terms of, like, how do you lose weight? How do you eat healthy? That type of thing.
Well, look, that's another fascinating thing. It's amazing how we do so many things wrong in America, but think we're the best. And you look at we have the worst obesity in the world, the shortest life expectancy. And when you start looking at like nutrition and what people believe and what doctors tell patients, it all kind of goes behind this, like, let's eat a lot of protein and not a lot of carbs, right?
Oh yeah, Atkins, man.
Atkins,
ketosis, baby.
Yeah, and so I saw a patient yesterday, and the patient was like, I always, what diets have you tried before? I've done every diet. Okay, let me look through your diets. Okay, Atkins, ketosis, low carb. I mean, they're all the same diet.
Protein powder, right?
Protein powder. It's all the exact same diet. I'm like, you've done a lot of different named diets, but they're all the same diet. I'm like, yeah, they're all very similar. When you look at it, we eat more protein than any other country in the world.
Absolutely.
And you got to start to ask yourself, how's that doing for us? So Europe wanted to test this because Europe's catching up with us. And they did a study called the EPIC study. And the EPIC study is the largest database ever. It's 12 years now, I think 14 years now they have data. 500,000 people, 10 different countries, country-specific food frequency questionnaires so they can make sure they're really capturing what people are eating. And when you look at that study, the one food that is clearly correlated with weight gain over time, chicken.
Yeah, all you have to eat is grilled chicken. It's boneless, skinless chicken.
Yeah.
That's what we hear here all the time.
All the time. That's what every doctor tells every patient. I mean, every patient comes to me like, I'm supposed to be eating chicken. Now, the interesting thing is when you look at, well, first of all, we eat more chicken than any other country, obviously not working for us. Second of all, you got to understand that chicken, when our grandparents ate chicken, was a 6-month-old creature that was tiny. Right. And now it's a 6-week-old creature that can't even stand up.
Because of the steroids. They give the chicken so much steroids that in order to get the breast big, they don't care about the health of the chicken. You're right. So that has a lot to do with it.
Steroids, antibiotics.
Is the European sort of obesity epidemic, it's not due to the exportation of the Western diet or American diet?
Yeah.
Is it more than chicken? What about high fructose corn syrup? Where does that come from?
Funny enough, high fructose corn syrup doesn't seem to tie in. Now, look, there was a study on ultra-processed foods leading to obesity and low life expectancy. Right. And so it is. There is that. There is the ultra-processed food, the easy available calories. Those calories don't satiate. They provide no nutrients. All of that's a problem. But what I really liked is National Geographic said, well, look, we keep doing the same thing over again. Why don't we look around the world and find the cultures that
have zones, right?
There you go. Blue zone.
So explain what they are.
Yeah, so blue zones, they had a very, very good systematic way of evaluating these blue zones, and these blue zones have been studied for years. It's not like National Geographic discovered them. The first blue zone was Crete. What they don't really call it a blue zone anymore, but that was discovered in the 1940s and 50s after World War II. They went to the island, and these people lived unbelievably healthy lives, and that started this whole kind of this study.
They had the longest lifespan. Right.
Longest lifespan. So now the longest lifespan, there's 5 blue zones that have amongst the longest lifespan. There's Sardinia, island off of Italy, Icaria, island off of Greece, called the island that forgot to die. Nicoya Peninsula, Costa Rica, island off of
Japan.
Costa Rica, basically. Okinawa, this island off of Japan. And then
Loma Linda, right?
Yeah, I love Loma Linda because it's in the here. It's an island in the middle of. It's not an island, but it's right in the middle of the most unhealthy country in the world. But when you go and look at these cultures and you look at what they're eating and what they're doing, they're eating what's behind me, right? The focus is very high carbohydrate. It's fruits, vegetables. Like if you look at the Okinawans, mainly eat sweet potatoes, then rice.
Right, but it's natural foods. It's things that grow from the ground, not processed.
Yeah, not processed, and not meat and dairy and eggs. It's not high protein. The Okinawans get about 10% of their daily calories from protein, 10 to 12, whereas an American gets 15 to 20 and wants to get more. Lots of fiber. If you look at our diet, the RDA came up with what the recommended daily allowance for protein is, and 99% of Americans get that much protein. Only about 3% of Americans get the RDA for fiber, whereas you look at these other cultures, they're getting tons and tons and tons of fiber. And this creates a healthy microbiome, which is the bacteria in your bowels that play a big part in the health of your system. It's low in saturated fat. It's high in phytonutrients. And it's the way to go.
It is. I got a couple questions. One, tongue in cheek really is like, how have you avoided the ire of the meat industry? I mean, they'll sue anybody. And here you are telling people in America not to eat meat. Like, have you had any death threats? Have you gotten any rude letters, anything?
Yes.
You're careful, right? I mean, I get
a lot of that stuff. I actually got a private investigator because I get death threats. I get all kinds of things.
Oh my God. And all you're doing is trying to help people live longer and have better health.
Right? The interesting thing is now, and I don't know if this is the meat industry. I can't tell what's meat industry and what's not. But now, people take my pictures and create fake accounts online and do all kinds of crazy shit, dating sites and that kind of stuff.
Wait, really? So I can get you on Tinder or something like that?
Oh yeah, I'm on Tinder, Grindr, all of that stuff, and words with friends, people, and then these women come call my office, and Dr. Davis is scamming me and all this kind of stuff. It's not me, but I never know who's doing that. But yeah, there's people take their food very seriously, and they hate when I say that stuff. And I went to Washington to testify before the USDA because they have their food recommendations that come out every few years. And I'm sitting there, and there is a line of lobbyists from the egg industry, from the dairy industry, and these people are getting up saying outright lies at this conference. Like, meat is good for your heart. It's part of a heart healthy diet. It's how is that possible?
Well, they fund studies. They fund studies, and they have correlative data. Or God. I mean,
they did an interesting thing a few years ago. There was a study called the Siri Torino study, and you may have heard this new move. Their new move has been to try to convince you that cholesterol isn't bad for you and that saturated fat isn't bad for you. And so they did. It was a meta-analysis, so they used multiple different studies, but they wanted to show that saturated fat didn't cause heart disease, which is counter to everything we've ever heard about heart disease, right?
Right.
So they get out and the study ends, and they're like, "Yep, saturated fat doesn't cause heart disease." But if you look at the study, they only took studies where they controlled for cholesterol because cholesterol is an independent risk factor for heart disease. So what they basically did is they looked at a group of people, and if you had high cholesterol, they took you out of the study. So now it's people with not high cholesterol that are eating saturated fat. Well, saturated fat causes high cholesterol. Some people are genetically protected against that. So they basically correlated out the people that are protected against eating saturated fat, and all the poor suckers that would die if they ate saturated fat weren't in the study.
I know.
And then that goes out to the rest of the world that's eating saturated fat all the time and dying of our number one killer, heart disease. It's just absolutely, it's unethical.
Dude, it's unbelievable. Hey, speaking of studies, are you familiar with Christakis? He's an MD, but he went into public health. He's at Harvard. He looked at...
I know he is, yes.
Yeah. So he looked at, heart disease is contagious and independent of lifestyle, like eat what you eat and who your family risk factors. But obesity was also contagious.
Yeah, there's been a lot of studies about this where obesity runs in zip codes.
Right. That's what, and it's not exactly what you eat. It doesn't matter. It's independent of all that stuff. But you know what? Happiness is also contagious.
Yeah.
So so we are all, my point is like, we are all connected in ways that go far beyond that. We think we make individual choices just for us. So like if I am voting for this industry that creates really unhealthy young chickens on steroids and, to hell with giving them an ethical quality of life so I could have really big breasts, that's affecting you. And you're choosing to eat healthy. I mean, how long have you been a vegan?
Oh God, it's been a long time. So the first time I decided to start going plant-based was kind of interesting. So I wrote a book, The Expert's Guide to Weight Loss Surgery, told people to eat lots of meat, eat lots of protein, but I was gaining weight quite rapidly. And it was when my daughter was being born 13 years ago. So I went and got a life insurance policy, and they were like, "Oh, we can't give you this life insurance policy." It was Doug Gashman.
That's right. You made me use it.
Oh, it's Doug Gashman. Oh my God. So
Doug, he's in prison, right?
I think I heard that. Yeah.
Oh yeah. Anyway, go ahead.
I heard that. Crazy. So yeah, Doug calls me up and he's like, "We got a little bit of a problem with the insurance policy." What? I'm 35. What's the problem? I was like, "Yeah, well, you didn't do so well on your test." I'm like, "What? How not?" But I had elevated liver function tests, so they thought I was alcoholic, but I didn't drink alcohol. I had fatty liver. I had hypertension, and my LDL cholesterol was 190. And I was just like, "Oh shit!" So I went and saw a buddy of mine. And he's like, "Oh no, look, no problem. Look, we'll put you on a statin. We'll put you on a beta blocker. We'll put And then I'm just like, I know how this goes. I'm going to be on more and more meds, and I'm going to be like all my patients that have 15 pages and so of meds. And so I was like, okay, I got to change this, and I got to figure out why. Why do I have high cholesterol? Why do I have these diseases that the doctor is God model? I didn't think I could get sick.
Well, that's what happens when you pour dog food on eggs.
Dog food on eggs?
Chili and eggs from Denny's.
Oh, chili and eggs. You still remember my chili and eggs. That's how
because it's such a far extreme opposite of how you're eating now. I just couldn't pick a better example.
Geez, Jason, like you couldn't believe how different I am than how you knew me back then. I'm like just fanatic, because once you start feeling once I started eating this way and I really started feeling healthy, it's like, how could I have ever not done this? Like, I'm constantly thinking,
Of course I believe it. Of course I believe it. You're so passionate about whatever you're doing, you want everybody around you doing. So when you started doing this, you sent me pictures of this food that to me looked like vomit. You're like, doesn't this look good? It's like beans and all this stuff.
Beans are my thing.
I know. No, totally. I was vegan for almost 18 months, but I got so friggin' fat that I just couldn't do it anymore. Like I was eating I ate a lot of those like bars, those like meal replacement bars. And I didn't really read the labels. They had like 600 calories. I thought they were like an in-between snack bar. So that didn't really work.
Especially nowadays. So when I first started doing this, there weren't that many foods. But now, like, you could eat a Beyond Burger and so I definitely see people gaining weight. But, my diet doesn't look like that. It's oatmeal and berries. It's big salads. It's beans and vegetables and rice. And
if any of the listeners think that, I need to eat meat in order to gain muscle, I could tell you, Garth does like Ironmans. I don't know if you still do them, but like the pictures of him shirtless at our age, I got to tell you, he looks better than we did in our 20s.
Oh, so, wait, like I've got like a six-pack abs now, and I have a six-pack. I wish I had a six-pack in college when we were chasing.
You were always thin, but you were never defined. And then
I was never defined, right?
Yeah, so this lifestyle is, and you're older, way older. So it shouldn't happen this way, but it is. You're a testament to healthy living, absolutely.
Yeah, and the funny thing is it's kind of easy for me. I love to teach it to patients, and there's nothing greater than seeing a patient turn their life around. Like you must feel getting someone who's addicted in their life as hell and getting to turn their life around. There's just nothing greater.
Yeah, it's the most rewarding thing ever. Yeah, absolutely.
Yeah. And so I focus, I still do weight loss surgery. I still will use medicines and stuff with patients because sometimes you need that stuff. But my main focus is let's change your lifestyle. And it's that lifestyle change that I think really creates this just completely different human being.
So, hey, tell the listeners before we get into like the positive intervention, what name of the books that you wrote?
I wrote, so one is Proteinaholic. And so this is about our that idea you said that people think you need to have protein in order to build muscle. And I went crazy. Like you said, I get passionate. I went crazy writing this book. I mean, the bibliography is a little bit ridiculous. So it just goes on forever. So I went over every basic scientific study, looking at protein, looking at how much we need, how much we do eat, and how it could be associated to disease.
Okay.
And
so
then the other,
that's your most recent one.
That's my most recent one. You can see this one's older because I have black hair. And now it's called The Expert's Guide to Weight Loss Surgery.
All right. Perfect. Awesome.
Yeah.
Thank you so much for taking the time to be on. Our listeners are going to dig it. And thanks again for joining us. Thanks, buddy. Love you.
Okay. Love you, man. Take care.
Thank you for listening to this episode of Positive Recovery MD. Don't forget to visit positiverecoverymd.com to sign up to get your daily positive intervention sent straight to your inbox. Be sure to subscribe to Positive Recovery MD on Apple Podcasts or wherever you listen to your podcasts to receive an automatic download when a new episode drops. And as always, if you or someone you know needs help, visit positiverecovery.com or call 877-4SOBRIETY, which is 877-476-2743. We are here to help.